I'm Susan Cauley, and welcome to You're Not Alone Surviving Your Child's Disability. Facing and understanding your child's autism diagnosis takes courage, patience, persistence, and lots of love. Examining autism spectrum disorder in present day on today's show is Karen Levine, PhD psychologist, and Naomi Ched, licensed mental health counselor specializing in autism and other developmental disabilities. Welcome to the show. How are you today?
Good, thanks for having us.
Good. Will you explain, first of all, what the autism spectrum disorder is and what it's not?
Go ahead.
Oh, okay. Autism spectrum disorder can be characterized by several core deficits. These include language and communication, especially social communication, deficits in understanding and communicating through nonverbal means as well as through language, and often certain types of behaviors, repetitive behaviors, maybe restricted interests, sometimes sensory sensitivities to things that, reacting to sensory sensitivities, having sensory sensitivities, and reacting in a very dramatic and intense way. These are probably the core deficits of autism, and then they include a lot of other kinds of kids and adults as well with autism, with an autism diagnosis may have other presentations as well. But I think if you were thinking about the primary deficits, they would be in language and social communication and nonverbal communication.
And a spectrum basically is that, you know, you can have some of the characteristics, you can have all of the characteristics, or everything in between. Okay.
And well, another aspect of the spectrum is some kids with autism are bright, even gifted. Other kids have intellectual disabilities.
Right.
Some kids are very verbal, but not great at conversation. Other kids don't have any language. So there's a big spectrum along a lot of other dimensions as well. And as the often quoted phrase is, if you've met one child with autism, you've met one child with autism. There's huge variation within the core
I like that
issues.
saying.
Yeah.
We've discussed some of the signs and symptoms of autism. At what age do you think autism is more likely to be detected?
Detected, probably it's detected at least, I would say, after 18 months or around 18 months and after. I think that there's sometimes a feeling that it can't be detected till 3 or 4, but in fact it can be detected and diagnosed much earlier than that. And what happens often is that parents will notice not what their child is doing, but what they're not doing. You know, a child might reach all their motor milestones on time or even earlier, but when they start not talking, when they're not saying a few words by the age of 1 or a little bit older, when they're not making eye contact, sometimes the first thing we hear from parents is, I thought he was deaf.
Yes.
You know, he didn't answer when I called his name and we took him for a hearing test. Or he never looks at me. Or when I smile at him, he doesn't smile back. So those are kinds of the first red flags that we often hear.
Okay. Now, what is the CHAT, or the checklist for autism in toddlers, and can it help in early detection?
It's a very useful tool, the MChat, and you can download it from the internet. We often tell parents it's useful as a screening tool, and pediatricians sometimes use it as a screening tool. But if you have concerns about your child and you want to talk to your pediatrician, it's useful to fill out the form first, so you can say, these are the issues I'm concerned about, and here they are on this form. So we find it very useful to bring right to the pediatrician.
Great. Now, how else can a child be evaluated besides the pediatrician? And what other professionals are involved in giving this diagnosis?
Well, us, or people like us. Actually, often it's a psychologist, a developmental psychologist, or someone, or someone who has training and experience in identifying these deficits and has a developmental background. Sometimes it's done by an individual, sometimes it's done by a team of professionals that might include an occupational therapist. A speech and language pathologist often is a member of that team. physical therapist, probably not, but sometimes they're part of it as well.
Right.
But primarily it's a person who has a developmental training and experience in recognizing these symptoms.
Mm-hmm. Now, how should a parent proceed once they find out definitively that their child has autism?
There's so many, there's almost too much information out there, so it can be very overwhelming to try to figure out what are the next steps, what should we do next. Finding some professionals that you trust and getting good guidance is really helpful, and then finding other parents is extremely helpful. And there are a lot of, there's several agencies locally that are really wonderful for that. There's the Autism Support Center in Danvers that's out through the Northeast Arc, and they provide wonderful information and referral for parents who've just gotten a diagnosis, and parent support groups.
Yeah. And I'd like to add to that, I think one of the first things parents can do is realize, if they can accept this message, is realize that they're not alone. There's a great deal of help available, and as Karen said, there's almost too much available on the internet, and they're going to get lots of advice from people who know someone or have a child or a relative with autism, and they're going to meet many of them right away. But to really understand that they're not alone, that they're not going to go through this alone, that they're going to be accompanied by a lot of really good, caring, skilled professionals on this journey.
Okay, and how do they get, how does the child get involved with early intervention? I mean, is that something that the pediatrician recommends, or what happens?
Right, parents can call themselves, or they can be referred by their pediatrician. And then once you're hooked into early intervention in Massachusetts, if you have an autism diagnosis, early intervention together with you can hook into the specialty service provider system.
And the system.
And then the school ultimately. Right. So there are lots of resources in Massachusetts from birth on.
Now, when a child gets a little older and they get into the school system, when should parents consider placing their child in a school that is specifically for autism, and when should they continue having their child in an inclusive situation in the school itself?
What the right educational situation is for any child depends as much on that specific child as on what the school system provides and the match between the two. And just as there's a spectrum of kids, there's a spectrum of needs and a spectrum of services that are appropriate. So it's really a very individual kind of question. You really want every child to be successful, to be learning, to have social connections, and to have fun. And where that's going to happen most effectively is going to vary.
Now, when should we consider medications as part of this, to lessen the symptoms, in other words?
I mean, I think like any other condition or any kind of situation or condition that's influencing or affecting a child in a dramatic way and preventing him or her from having a good quality of life, or preventing him from learning, from accessing a school curriculum, from having friends, perhaps a child with a really tough sleep problem or extreme behavioral problems. Now, all of these kids may or may not be appropriate for medication, but that's a time, I think, when a condition starts interfering with the quality of life for that child and for the family as well. It's a time to think about medication, but I wouldn't suggest jumping to any conclusions. I would talk to a very skilled and experienced psychopharmacologist who specializes in treating children with developmental disabilities and specifically autism.
And usually medication is one of several ways you're treating a particular problem or challenge. So if a child has really big attentional problems, you want to make sure the learning is interesting to them, is a good fit for them, the environment's a good fit, and then you might also consider medication. So it wouldn't be the only way you're treating a problem.
Right. Speaking of treating, how do we treat children with autism?
Well, just like there's a spectrum of kids, there's a spectrum of treatment approaches. And there's sort of whole package treatments that treat all the different facets of autism. There are behavioral treatments, there are social, relational, developmental treatments, and there are a lot, there's a range of treatments now that are, all of which have research backing. So that can be a complicated question too. And then there are specific treatments for specific types of challenges as well.
What about behavioral challenges? It seems like a lot of autistic children have behavioral issues as far as if they don't get what they want, like normal kids, but they seem to go that extra mile and tantrum for hours over one incident. How do we deal with these behavioral issues?
Yeah, well, again, it depends on the child, and I think the most important thing any professional can do is identify what drives that child, what's turning that child on, how can you motivate that child, how can you get their attention and soothe them or satisfy a particular need that's causing that an underlying cause of that behavior. So I wouldn't ever make a blanket statement saying, well, if your child has behavioral problems, do this. It depends on the individual child's profile, and as I said, what drives them, what's going to turn them on, what's going to help them feel better.
Yeah, and what about the hand flapping? Is that anything that anybody has ever been able to diminish?
Well, very often hand flapping is a sign of either excitement or distress. And I always say, if you look at people at a football game, everybody's hand flapping.
Right, that's true.
It's what we do with it. It's part of excitement for all of us.
They
but
have a
it's
lot of other behaviors too.
Right.
Yeah.
But often, if a child's very dysregulated emotionally a lot of the time, then you might want to treat the dysregulation. But there may not be a need to treat the hand flapping per se. It might just be an indicator that the child's excited. You might want to give them other ways of expressing excitement or distress.
Yeah.
Okay.
It's interesting because that's one of those things that sometimes upsets parents
Yes.
or relatives more than
It's like, why are they doing
why are they
that?
doing that? And sometimes I know parents have said, well, I taught him to, instead of do this, to clap his hands or to, to cheer or to give a high five.
Right.
So sometimes you can help shape that behavior to turn it into something that's more socially acceptable. But if you spend a whole lot of time trying to make a child stop flapping, I think you're going to miss a lot of other opportunities to help them with other issues and other deficits as well.
I have a daughter who's 26 who still does it on occasion. She just gets overly stimulated, and she's just, it's just funny. I mean, I'm used to it, but when people see it, they're like, whoa, what's that?
Yeah.
And sometimes I find it's helpful to have a quick way of explaining, oh, that's what she does when she's excited. What do you do when you're excited, to other kids to help them translate?
Oh, that's great. That's a great idea. Now, have you ever heard of any vitamin supplements or a diet to help with the severity of symptoms?
You hear every day, you can wake up and go to the grocery store and see a tabloid or open up, log on to the internet and see, great new diet, this cures autism, or this, helps with this deficit, or this increases communication. Last night I was looking at the internet, and there is actually a study that shows that vitamin D may have some positive effect on the core features of autism. But tomorrow, I bet I'll look at the internet and it'll say, all bets are off. Yeah, forget about that vitamin D. Yeah. So I would never, I'm not a medical professional, so I would never recommend that a child take or not take a certain vitamin, or stop eating something or start eating something. But you can find all kinds of articles, and there's research going on, and that would be great if there was some real convincing research that absolutely connected improvements in some of those core deficits to specific vitamins or a specific diet. But
speaking of eating, do most children with autism have some sort of tactile problems with eating?
Well, a lot of kids with autism have sensory sensitivities, so certain kinds of textures might bother them more. Some kids have low tone, so managing certain kinds of foods might be more difficult. And so a lot of kids don't like new stuff, so they might just like their familiar foods. So all of those can come together and create feeding difficulties in some kids.
What about repetition?
Like
repetition or familiarity with
Exactly,
Yeah.
like they like
It's a
things
comfort,
right,
yeah,
the comfort
right.
the same way.
things.
And you see that a lot in typical little kids too, but sometimes that lasts longer.
Right, right. I remember my other daughter used to eat fruit roll-ups till they were growing out of her ears, because
Right.
she just she ate it for like about a year, I think, of fruit roll-ups and milk. That was all she used to have.
I had a patient where the child only liked a certain brand of cereal, and that's all they would eat practically. So, and the company was going out of business, so the mother wrote to the company and got a couple of cases of it.
Oh
Right?
my goodness!
You can usually very gradually increase a child's repertoire, though.
Oh, that's funny.
In fact, I saw a young man this week, and he said, "I figured it out. I like 15 different things, and that's it." And he
15 different
Yep, he
things?
rattled off the 15 different things, and I, mentioned a couple of variations, like how about rye bread? How about wheat bagels? White bagel. 15 different things, and that was it. We counted them, and that's not atypical, I don't think.
Yeah. How do you deal with something like that? I mean, when they have that specific of an eating, like they'll only eat like 2 items. How do you get them to eat more than that? Or is it safe to only eat those 2 things for 6 months or whatever?
I mean, it probably isn't the best thing for your health to eat even 15 different things, but there are a lot of different ways of increasing, or, sort of, on one hand, you can sneak certain things into kids' diets by making banana bread or zucchini bread or things like that. But you can also use sort of a playful approach to increasing their repertoire, or increasing their willingness to try new foods by making it fun, making it a fun activity, cooking with them, giving them a lot of choices, doing silly things with kids to try to get them engaged. And sometimes you can really hit it. And sometimes kids will really like foods that they didn't try before because they never tried them. And we often see kids that we refer to as they're on the beige diet. Well, we can kind of try to sneak a few colorful things, but you have to make it fun, and they might try it.
I guess that's an interesting. I've never ever tried to. I mean, I cook with my kids, but I never actually tried to get them to make things with their food or whatever to make it fun.
Keep it playful and I mean, the tricky thing is you don't want eating to become too much of a power struggle, because you don't want the child to shut down. It's like, okay, you win, I'm not eating, that kind of thing. So you want to really keep it engaging and fun as much as possible.
Now, what about the possibility of, you hear every so often the exclamation that somebody recovered from autism. Do you ever outgrow autism or recover from autism? Do you believe?
There's a small percentage of kids who are diagnosed very early and whose symptoms are relatively mild who do outgrow the symptoms, who look indistinguishable from kids who don't outgrow. So there's a lot of research going on. Debbie Fine is a psychologist, I think she's actually a medical doctor, who does a lot of research in the small percentage of kids who do outgrow. It's not the norm, but it does happen. And then some
No, go ahead.
Some kids move into so they may outgrow autism, but they might have nonverbal learning disability or some anxiety or communication delay and anxiety, some other kinds of things.
Okay.
And then there are a lot of kids who do still carry the diagnosis and actually meet the criteria if you wanted to do an evaluation again. But they've learned, they're bright, and they've learned such good coping skills that unless you're really tuned into what is going on and you know what you're looking for, you wouldn't notice on a day-to-day basis that they had an autism spectrum.
And those are children that usually are on the lower side of the spectrum.
Well, they're probably pretty bright kids. I mean, I don't know, recently Jerry Seinfeld came out and said that he was on the spectrum. I'm not sure about that, but I think that there are a lot of that's another important message, is that there are a lot of very bright, capable, very high-functioning people who probably meet criteria for an autism spectrum disorder.
Now, what are some of the causes of autism that are currently being discussed? Do you, there was the argument at one point about vaccinations being a problem. I heard the new theory that the lack of iron intake of pregnant women causes autism. I mean, is there anything that they have really come up with that possibly might be the cause of autism?
It's lots and lots of money and research hours have gone into that question, and whenever a new cause is reported in some small sample, it's not replicated in a huge sample. So there are some known causes and some known links, but for most people we don't yet know the causes. And as you say, you keep hearing another news story that maybe they figure out the cause in some small number.
Right. I think that's key. It's, there is a small percentage of cases of autism that they can find a specific genetic link. And there are some genetic disorders that are, identifiable, such as Rett syndrome and tuberous sclerosis, which is actually, you can identify the gene that causes those disorders. And there's an autistic presentation associated with that. But it's not like, like a lot of diseases, it's not one thing. It's not like, just like cancer doesn't have one cause. There are a lot of different causes for different cancers, and there are a lot of different causes for different types of autism. And sometimes it's a combination of those circumstances, and it's probably, a combination of nature and nurture. It's not one thing.
That's how I've always viewed it.
Yeah.
But I didn't know if there was anything that
yeah. I mean,
eventually
going on all the time. Yeah.
Eventually we'll probably know much more than now.
Right.
Now, how do parents cope with the financial burden of having a child with autism? I mean, what are they? I mean, financially, all this therapy. I mean, there's only so much that's covered by insurance. How do they cope?
It's very, very tough. I mean, I think in the United States it's better than many other countries, and in Massachusetts it's a particularly good state to live in terms of educational services and insurance coverage, but there's still a lot that's not covered, as you know. So it's very tough.
I think it's getting a little better, at least in Massachusetts. There are more insurers are covering more services for longer, but as you know, probably as a parent, there's no limit to what you want to do for your child to help them get better, or to help them be better at something, or to help them feel better and have a better life. So there's never enough money for that. And insurance will not cover a lot of those services. And a lot of the services include, recreational things, groups, play groups, and then, travel groups and activity groups and dance and gymnastics and music, and those are services that probably is going to have to come out of your pocket if you want to help your child in that way. So medically is one thing, but then when you have these other kinds of services, which I think are equally, if not more important, as the child gets older, you can run up a pretty big tab.
Yeah. How is recreation like an extremely important part of teaching children?
I think pursuing children, helping children pursue their interests, helping children expand their interests, I think that's sort of quality of life for all of us, is having interests and having people to share them with. So if a child shows any interest in music or movement, which most children do, finding some kinds of community
But
sources
don't
for
autistic children need to be exposed to different things in order to accept them? I mean, in some way. I know I used to take my kids out to eat all the time, and as a result, they know how to act inside a restaurant. Of course, they only want to go to certain restaurants, but anyway, but they do know how to act. If you don't take your child out, your autistic child out, for fear they're going to act out, won't they not be able to accept that in the future, or accept those particular activities in the future?
Yeah, I think anything you can do to expose your children, any children, but certainly a child who has more difficulty transitioning from one thing to another, or opening their minds to trying something new. I think, absolutely, it's important to expose them, to give them a lot of options, to constantly take them to places where they can practice being, among the general population. And, what do you know, they might find that it's really fun. They might, really start enjoying it and become more accustomed to it. I think a lot of success for a lot of kids with autism is just getting used to it. And there's a tendency to not take kids to a place where they've had a meltdown, or they've thrown food, or they've screamed and embarrassed you and your entire family. But that's exactly what you need to do, is to keep going back there and practicing and practicing. And so yeah, absolutely, taking them out and getting them out into the community and exposing them to a variety of activities and different populations is the best thing you can do. But it's not easy. I think I would.
And often you want to.
It's not easy. Yeah.
You often want to go when it's not busy too. So you can go first thing on a Sunday morning to a restaurant or a place, or the mall or something, before it becomes packed and zooey and crazy.
Right. Do a lot of people who have autism do have a lot of sensory issues.
Yeah. And that includes noise. A lot of kids get very overstimulated by noise or crowds or.
Unpredictable busyness. Yeah.
Yeah, bumping into people at malls can be really, really uncomfortable and set kids off and their parents. And I mean, I think a lot of us have a lot of those same reactions, but it's a matter of degree. What might upset you a little bit might upset a child with autism a lot.
And how has autism affected your life or the lives of people that you know are autistic? It's a very broad question, but you can think about it for a minute.
Well, we've both been doing this maybe 25 years, something like that. And so we've had the amazing privilege of watching a generation or several generations grow up within the time that we've been doing this. And we've had the opportunity to talk with some of our early patients who are now young adults about their experiences. And we learned so much from that. And then to know parents over those years and learn so much about the process, and even hear about ways we might have helped them better that we now can do. So it's been a real privilege for us to be doing this for so long.
And actually, both of you have co-authored these books that are available for purchase, and it is very informative. So if you have any questions, you should look these books up. Additionally, finally, is there anything that you want to add in reference to autism and dealing with autism as children, or?
I guess one of the important message I think that people should get is yes, it's a devastating experience to get a diagnosis, to find out that there's something wrong with your child. And that's not the child that you expected, and you immediately start going decades ahead and wondering what's going to happen in the future. But I think the real message is that you can still have a really good life. You can still really enjoy your child. A lot of the kids we know, we adore and we get a kick out of, and they're not the typical kid you see on the television sitcoms. I guess maybe they are these days, but you can really go forward and have a very good life and really enjoy your kid. And I guess that's the other major message that I would want to impart is that for any parent who does have this, who has recently or not so recently gotten this diagnosis, is look for the things in your kid that made them endearing to you in the first place, and really zero in on those things and enjoy everything you can about that child. And it's not going to be easy, but it can be rewarding in ways that you never imagined and never expected.
Right. An autism diagnosis doesn't define your child or define you. Every child with autism is a special, unique, complicated individual and needs their parents' support and love just as much as any other child.
Thank you very much for joining us today. Thank you again for this comprehensive discussion on autism. Hope you join us for a continuing dialogue regarding future planning for your child with autism on our next show. See you next time on You're Not Alone, Surviving Your Child's Disability.